Hi, I'm Dr. Chris Barkmeyer.
I'm Dr. Sebastian Gonzalez.
And today we're here to talk to you about overuse running injuries. Races are coming up and you're working harder and harder, and you should be aware of all the overuse running injuries and how to correct them and assess them. Sometimes they're really easy and other times they're more difficult, and they could be the cause of abnormality of gait.
In this video we're going to show you some really easy ways to assess some very simple biomechanical problems that can really affect your running. At any point in this video, if you have some pain or discomfort, please stop, give your qualified medical provider a call so they can properly assess you, because this is all for informative purposes. The first screen is called the overhead deep squat. So Dr. Barkmeyer is going to try it out for us here just to see what he's got. So go ahead and squat down as far as you can. Keep the feet straight and shoulder width apart, and keep that club high in the air as far as you can. So you want to go ahead and try it for the other direction. Alright, so the faults we're looking for here, if you fail, if you can't pass parallel, but number one, we're going to look at, see his trunk go forward right here. He's going to demonstrate one of the fails for us. You go forward, and that is a fail. If he doesn't pass parallel with his thighs, that's a fail. If his heels come up, that's a fail. And also if you turn your toes outward when you're doing it, those are all fails, and that's when you want to take it to the next screen.
This next progression is the modified overhead deep squat. What we're going to do here is Dr. Gonzalez, he's going to go ahead and put his hands on his neck. He's going to have his feet pointing forward and about shoulder width apart, and now he's going to go ahead and squat. Okay, so what we're looking for here is, if he's still leaning forward but it's a lot easier, then we can pretty much guarantee that that's an upper body issue. And we're going to go ahead, he's going to turn to the side and he's going to do it again. Okay, so if it's easier here, then it was probably an upper body issue, but let's say he can't go past 90 and he's having trouble and his heels are lifting, then we can pretty much assess that it's a lower body issue, and that's really going to affect your running, and that's something we really need to get into.
Okay, so now we're on to the third screen. This is going to figure out whether ankle mobility has an issue to do with why you can't deep squat, which is one of the most common reasons why people can't deep squat. So what he's going to do is you're going to hold the pole, hold the golf club or hold a stick, anything, about a fist worth out from the toe here, and he's cheating a little bit. So right there, and now he wants to keep his heel on the ground, bring the knee out to try to touch the pole. You should be able to touch the pole, so let's see if he can. So good, he's pretty good there. Now the people that fail this, they'll come out, but they'll lift the heel up, and also come around and do it from the. So we're going to do it from the front view right now, and we'll show you what people usually do also when they can't dorsiflex and evert the ankle, which is the kind of motion we're looking for. So you'll see he's darting his hip out. That's one of the body's most common ways of compensating for lack of ankle motion. This can have a lot of stress on the knee and also on the hip. So this is probably something you really want to get checked out if you're positive for this test.
So what does all this mean? As we stated before, these are just a few screenings to check to see the effectiveness and the safety of your running. If you fail these tests, that means your biomechanics are probably poor, and the chance of you getting overuse injury as you're running more miles and more miles, building up for a race, is a lot higher.
So we've done a couple screens here today, but there's also more things to look at when it comes to running. Other important muscles or muscle groups are the glute max, the hip extensors, the quads, and we looked at the calves a little bit. So it's important to have full function of all these muscle groups to effectively run and get the times you want. If you don't, you're losing lots of power, your time is definitely increasing, and you have a high risk for injuries.
How to correct it? You can stretch, you do specific exercises, we can do active release technique. The fact is, we can tell you all kinds of things to do and it'll probably help, but if your ankles aren't moving and your glutes aren't firing, you need to come in and get evaluated by us so we can check you out and see what's going on. There's a running fit and there's a physically fit. You want to be ready for the best run of your life, you need to come in and get assessed.